After years of scaling up HIV prevention, treatment and care, the survey seeks to collect finer details to assist in policy decisions and resource allocation. According to principal investigators, the country is at 5.9 prevalence rate, translating to 1.5 million people infected with the disease, with a significant number unaware of their status.
That more needs to be done in order for Kenya to be HIV-free by the year 2030. You will note that up to 53% of HIV-infected persons are unaware of the HIV infection status. Further, while over 1.1 million people living with HIV and AIDS are on treatment, this represents only 73% of the estimated need, and viral suppression is currently estimated at 83%.
According to the Director of Medical Services, Dr. Jackson Kioko, the survey will ensure comprehensive impact assessment and offer solutions as the country moves towards a HIV and AIDS-free generation by the year 2030.
We launched this very important survey, which is a population-based survey. Again, a major departure from what we have heard in the past undertaking the Kenya AIDS Indicator Surveys.
The project under Kenya Population-Based HIV Impact Assessment KENPHIA targets over 36,000 individuals and will also focus on testing for sexually transmitted diseases, hepatitis B and nutrition among expectant women and children on a voluntary basis.
What we want to avoid is the new infections, whether amongst adults or amongst children. And that is really our goal. That's why we have the 3 90s, but for prevention, the third 90 is the single most important. As you know, treatment now is one of the most efficacious forms of prevention.
There has been concerted efforts from all quarters towards scaling up treatment and prevention of HIV and AIDS. And this new survey only hopes to ensure a generation free from the disease by the year 2030. So as they set out to the villages and across the counties, they only hope for cooperation for a free generation by the year 2030. Rose Gakofo, Channel 1 News Hour.